Welcome to the channel. I'm Dr. John, a specialist in musculoskeletal health with over 15 years of clinical experience in bone care for middle-aged and elderly patients. Today, we're going to explore a topic that's becoming increasingly common in today's society, especially among people over the age of 50, osteoporosis and fracture risk. Why do our bones become weaker over time? How can we effectively prevent osteoporosis? And most importantly, what are the 15 foods that scientific studies have confirmed can help improve bone density? Stay with me until the end of this video to gain the most comprehensive and practical understanding. The knowledge shared today could help you or your loved ones avoid dangerous fractures in the future. Why do we develop osteoporosis and become more prone to fractures? First, let's clarify something important. Osteoporosis is not just a natural part of aging. It is a preventable and treatable medical condition. According to the World Health Organization, WHO, osteoporosis is defined as a decrease in bone mineral density and a deterioration of bone microarchitecture, making bones brittle and more susceptible to fractures even from minor impacts. From a biological standpoint, osteoporosis occurs when the balance between bone formation and bone resorption is disrupted. There are three main mechanisms involved. First, there's a decline in the activity of osteoblasts, the cells responsible for building new bone. As we age, the body's ability to generate new bone tissue diminishes. Second, there's an overactivity of osteoclasts, the cells that break down old bone tissue. When these cells become too active, bone loss accelerates. Third, hormonal imbalances play a crucial role. In postmenopausal women, a sharp decline in estrogen triggers an increase in bone resorption. In older men, decreasing testosterone levels also contribute significantly. Other risk factors include nutritional deficiencies, especially calcium, vitamin D, and vitamin K2, physical inactivity, smoking, alcohol consumption, long-term corticosteroid use, and endocrine disorders such as hyperthyroidism or hyperparathyroidism. According to data from the National Institutes of Health, 1 in 2 women over the age of 50 will experience an osteoporosis-related fracture in their lifetime. In Vietnam, a 2018 study from the University of Medicine and Pharmacy in Ho Chi Minh City reported that 32% of women and 16% of men over 50 suffer from osteoporosis. These are alarming statistics. Comprehensive solutions for preventing osteoporosis and fractures. To prevent osteoporosis effectively, multiple strategies must be implemented simultaneously, with nutrition playing a central role. First, engage in regular physical activity, especially weight-bearing exercises like brisk walking, stair climbing, yoga, or light weightlifting. Aim for at least 150 minutes of moderate activity per week. Second, ensure adequate vitamin D intake. Vitamin D enhances calcium absorption from the gut. The best natural source is morning sunlight, about 10 to 20 minutes daily. If deficient, doctors may recommend supplementation ranging from 800 to 2,000 IUs per day. Third, meet your daily calcium needs through diet. The recommended daily intake for adults is between 1,000 and 1,200 milligrams. Prioritize calcium-rich foods before considering supplements. Fourth, for postmenopausal women and older men, periodic monitoring of hormone levels is essential. In certain cases, hormone replacement therapy may be considered under a doctor's supervision after carefully weighing benefits and risks. Fifth, undergo bone density testing, DEXA scan, regularly, especially if you're over 50 or at high risk. Lastly, prioritize quality sleep. Research shows that poor sleep disrupts growth hormone secretion and negatively impacts bone regeneration processes.
15 scientifically proven foods that support bone density.
Here are 15 foods highly recommended by medical and nutritional studies. Salmon, an excellent natural source of vitamin D, providing about 447 IU per 100 grams. Rich in anti-inflammatory omega-3 fatty acids, salmon has been shown in a 2015 study published in the Journal of Nutrition, Health, and Aging to improve bone density when consumed twice a week. Milk and dairy products. One 250 milliliter glass of milk delivers around 300 milligrams of calcium. Choose dairy products fortified with vitamin D for added benefit. Soy and soy products contain high levels of isoflavones, which help reduce bone loss in postmenopausal women. Almonds provide approximately 75 milligrams of calcium per 28 grams, along with magnesium and zinc, essential minerals for bone mineralization. Cooked spinach. 1 cup offers about 245 milligrams of calcium, along with significant amounts of vitamin K1 known to reduce fracture risk. Kale delivers around 150 milligrams of calcium per cup, along with antioxidants and vitamin C. Canned sardines with bones provide about 325 milligrams of calcium per 100 grams, plus a good amount of vitamin D. Maitake or portobello mushrooms exposed to light contain up to 446 IU of natural vitamin D per 100 grams. Eggs, especially the yolk, offer around 40 IU of vitamin D per egg, plus protein necessary for bone structure. White beans deliver 161 milligrams of calcium per 100 grams, along with magnesium and potassium for electrolyte balance. Chia seeds, with 179 milligrams of calcium per 28 grams, are an excellent plant-based calcium source, also rich in omega-3. Flax seeds provide ALA, a plant-based omega-3 fatty acid, along with magnesium and calcium. Oranges and citrus fruits, high in vitamin C, which is crucial for collagen synthesis, a major structural protein in bone. Dried figs contain up to 241 milligrams of calcium per 100 grams, making them a great option for natural calcium intake. Broccoli offers vitamin C, vitamin K, and folate, all of which are beneficial for bone health. 10 foods to limit to prevent bone loss. While some foods support bone health, others may increase bone loss if consumed excessively. Here are 10 food groups to watch out for. Carbonated soft drinks. High phosphorus content increases calcium excretion through urine. Coffee. Consuming more than 3 cups a day may reduce calcium absorption. Alcohol inhibits the activity of osteoblasts, the bone-forming cells. Salty processed foods. High sodium content promotes calcium loss in urine. Excess red meat can cause blood acidity, triggering bone resorption. Excess table salt. Every 2,300 milligrams of sodium can cause the body to lose about 40 milligrams of calcium. Refined sugar hinders calcium and magnesium absorption. Dark chocolate, in large amounts, contains oxalates that interfere with calcium absorption. Strong black tea. Tannins can reduce calcium absorption if consumed excessively. Instant noodles, high in phosphates and sodium, both detrimental to bone health when overconsumed. Important cautions: food and drug interactions. For those undergoing osteoporosis treatment or with chronic illnesses, be aware of these interactions. Calcium supplements should be taken at least 2 hours apart from iron supplements to avoid absorption issues. Calcium can interfere with certain antibiotics like tetracyclines and fluoroquinolones, reducing their effectiveness. Soy products may reduce the effectiveness of thyroid medications. Grapefruit juice can enhance side effects of some osteoporosis medications. Always consult your doctor before starting any new supplement or making significant dietary changes. Osteoporosis is a silent but serious threat, especially as we age, but with the right knowledge, proactive lifestyle changes, and a nutrient-rich diet, we can strengthen our bones and reduce the risk of fractures. If you found this video helpful, please give it a like, share it with your family and friends, and don't forget to subscribe for more in-depth health guidance from a medical perspective. Thank you for watching, and I wish you and your loved ones strong, healthy bones for years to come.